One of the most important things that can be done to monitor your limb for swelling is to measure it. Your therapist will measure both of your limbs before you start any treatment so that they know what the size of your limbs are under normal circumstances. The other piece that's important in measuring your limb is measuring change over time. Your therapist will use a consistent measurement technique and will measure you at follow-up visits to determine if there are any changes that might be indicative of early swelling. There are many different techniques that your therapist can use to monitor your limb for swelling. Among these are circumferential measurements that are done with a simple tape measure, the use of water displacement techniques, bioimpedance spectroscopy, and infrared optoelectronic techniques. Although these techniques are different, each of them are valid ways for us to measure and monitor your limb for swelling. Some of them are more complicated than others and take more time. Some of them are more quick. The most important thing that your therapist can do is to use the same technique in relatively the same way each time they measure your limb. It's important to remember that not every person going through cancer treatment will develop lymphedema. The problem is, we don't really know how to best detect who lymphedema will impact. One of the most sound ways that we can monitor you to determine whether or not you are beginning to develop the signs and symptoms of lymphedema is by measuring your limbs. It's important to get that baseline measurement so that we know what your normal limb volume is. It's also critically important to repeat those measurements over time. Again, about every 3 months during the course of your cancer treatment. As different cancer treatments are introduced, such as different chemotherapy agents and different radiation therapy treatments, we may see changes in your limb volume indicative of the onset of lymphedema. The only way to know if this change is meaningful over time is to continue to measure. The measurement technique that the therapist chooses at baseline should be repeated almost exactly as it was done the first time. Another important point is that at each of those visits, when your therapist repeats your limb measures, it's important that they measure both of your limbs. Again, if you gain weight or lose weight throughout the course of treatment, that will be reflected and happen in both of your limbs. It's when we see one limb, specifically the one where lymph nodes were removed from, that does something different than the other that we need to look a little more closely. Repeating the technique using a standardized methodology throughout the course of your treatment is a proven way to promote early identification of swelling that's consistent with lymphedema, engage in early conservative treatment, and potentially prevent lymphedema from becoming a chronic condition. A cloth or a plastic tape measure may be used by your therapist to measure the circumference or the girth of your limb to help them determine your limb volume. Your therapist will determine a repeatable starting point and outline designated points along your limb. The repeatable starting point is a measurable point that will not change, for example, the tip of the finger. The therapist chooses an interval of distance up the limb. 4 centimeters or 10 centimeters are commonly used on the arm and leg respectively. They then measure the circumference or girth of the limb at each of the determined intervals. This process is repeated all the way along the limb and is done on both right and left limb. It's important to measure the whole limb, as swelling may occur at any point along the length of the limb. It may not occur throughout the entire limb all at once, but swelling in early stages may be seen in certain areas of the limb and not others, and therefore measuring the entire limb is important. Using the circumferential girth measurements, your therapist may calculate a limb volume for your arm or leg and compare it to the other using a percentage, for example, telling you that your leg is 5% larger than the other. Or they may just tell you grossly the measurement size of your limb compared to the other. For example, your arm is 2 centimeters larger than the other. Bioimpedance spectroscopy, or BIS, is a technique that uses a small electrical wave through your body tissue to determine the presence of fluid. This technique is an FDA-approved technology that can measure the amount of fluid and changes in that fluid over time. BIS has been used in prospective studies to identify the early onset of lymphedema to promote early detection and early intervention. Because this technique assesses changes in the tissue fluid, it enables early identification of lymphedema. Early detection of lymphedema facilitates early intervention with conservative management and may help to prevent the condition from worsening to a more advanced stage. The device assists you in identifying the early onset of lymphedema before feelings of heaviness or visible swelling occur. To use bioimpedance spectroscopy, the operator will place small stick-on electrodes on the skin of your wrist and ankles. The device is then connected to the electrodes and a low-level electrical current is sent through your limb to measure the amount of fluid. The current is so tiny that you can't feel it. Both limbs are measured during the process to immediately calculate your lymphedema score. Water displacement is one way to measure your limb volume. Using water displacement, your therapist will have a large container full of water. Your limb will then be submerged into that container, and the amount of water that overflows will be captured and measured by the therapist. According to Archimedes' principle, the amount of fluid that is displaced when your limb is submerged in the water is equal to the volume of your limb. This gives your therapist a very reliable measurement of your limb volume. Infrared optoelectronic techniques are another way to measure your limb. This involves the use of an infrared beam that scans your limb and takes a picture of it. The picture that is taken of your limb is transferred to a computer, and a software program analyzes the picture, generates an after image of your limb, and calculates the limb volume. Infrared optoelectronic techniques have been shown to identify the earliest onset of lymphedema, sometimes before we can even see it visually. This technique, when used prospectively, using repeated methodology that measures your limb consistently, can help with the early identification and early management of lymphedema. Infrared optoelectronic technology, however, is very expensive. The machines that are used to measure the limb are rather large. Not every clinic has this technology available. To ensure the most accurate measurement of your limb, your therapist should repeat the measurement exactly the same way over the course of time at each interval follow-up visit. This consistent methodology helps to assure that any early changes are identified. When early changes are identified, early intervention ensues and can help to prevent your condition from progressing to a more chronic form of lymphedema.